welcome, and thank you all for joining us today. As we move into the second year of this COVID pandemic, I really wanted to create a format to help bring experts, parents, and our school community together to learn and understand the COVID pandemic and the impact it's having on our community. I'm looking forward to diving into our discussion this morning with two leading health experts in this area and in our region. We have with us today Dr. Jason Purnell. He is the Health Equity Works Director and Vice President of Community Health Improvement at BJC. And we also have with us Dr. Jason Newland. He's a Professor of Pediatric Infectious Diseases and a Professor of Pediatric Medicine at Washington University School of Medicine. Welcome, Dr. Purnell and Dr. Newland. We are glad to have you with us this morning.
Thank you.
Yes, thank you. Great to be here.
Awesome. So let's dive in. Can you both share just a little bit with us about who you are and about your experiences? And we'll start with you, Dr. Newland.
Yeah, I'm Jason Newland. I'm a pediatric infectious diseases doctor, as Dr. Davis just mentioned, who came to St. Louis in 2016 by way of Kansas City after spending my first 10 years of my career there. My interest prior to the pandemic has been antibiotic use. And then as the pandemic unfolded, I began working on our pandemic response.
Awesome. Thank you so much, Dr. Newland. I've actually been tested twice myself through the program and the grant that we have. So we're grateful for that. Dr. Purnell, tell us about yourself.
So I am just a little over a year, maybe a year and a half into this role as Vice President for Community Health Improvement. I spent over a decade on the faculty at the Brown School at Washington University in St. Louis, and focused primarily on health disparities and what we call the social determinants of health. So prior to the pandemic, already looking at the ways in which health is unequally distributed across the St. Louis region, and the factors that support health being unequally distributed. And it came as no surprise to me that we had an uneven burden of COVID-19 when it hit, because we know in public health, we have something called the fundamental causes hypothesis, which says that it doesn't really matter what the health condition is. Those who have fewer resources, less access, will always have a disproportionate burden of disease. And that's certainly what we've seen in the St. Louis region. I was actually on sabbatical when the pandemic hit and interrupted that sabbatical and with a number of other partners from around the region, established something called the Regional Response Team to try and address, again, what we knew would be the challenges, the social needs and social services and challenges that families would face in the course of the pandemic, and had the opportunity to work with you, Dr. Davis, and other school leaders, with social service agencies, with philanthropies, with government, to really try and find real-time solutions to the problems that people were facing. That's a bit about me. I'm a St. Louis native, born and raised, so this is my home, and I don't study and intervene out of some sort of academic curiosity. This is where my people are.
Yeah, awesome. Yeah, your work has been profound, and I've followed your work at WashU, and just really excited about some of the research you've done, particularly in the Black community. So we've been dealing with this pandemic for almost 2 years, as both of you have already said. In fact, it'll be March in about a month or so, and it'll be 2 years for us. So we know that COVID-19 has hit the Black and Brown community particularly hard, beginning, when we do this back in March, and as time went on, even as we've gotten the vaccine in place. Dr. Purnell, let me start with you. What challenges and health disparities are you seeing with COVID-19 and the African-American community in particular?
Well, my colleague and friend, Dr. Chris Printer at St. Louis University, has been doing yeoman's effort in bringing us daily updates on COVID rates, vaccination rates, hospitalization rates, just digging through the data. So I took a peek at his website last night And it's still the case that African Americans disproportionately high number of cases, disproportionately high hospitalization rates, and ultimately death rates from COVID. So those are the ultimate outcomes. But what we know is our community was also disproportionately on the front lines when you look at who was in essential roles, which we just figured out were essential in the course of this pandemic. We certainly weren't paying people as if they were essential and treating them as if they were essential. You think about factors like housing and the inability, if you're in a crowded household, to isolate and to follow some of the direction that Dr. Newland and others have been giving us. The inability to work from home, to have that luxury, and the need to use crowded things like public transportation in order to move around, and very often not having the most up-to-date information. And I'm happy to report that when we started this effort back in May or June, we were looking at vaccination rates in the 20s, and we're now looking at 40s, near 50% vaccination rate in some of those zip codes, but we certainly have more work to do.
Dr. Newland, you've learned a lot. Your team has started very early in the pandemic, looking at the impact on the school community, especially in under-resourced areas. You mentioned a little of that earlier, and sort of the grant that we're working through now, and FERC is a part of that, and the impact that the pandemic is having. Can you give us a sense of where we are in reducing the spread of the virus in communities, especially like my community here in North County?
Yeah, I think, if we just go back to our school communities, including Ferguson, Florissant, the others in our North County group that we work specifically with, Jennings, Normandy, and we look back at how the pandemic started with when just going back to school, and we compare that to our West County community, and like where the community I live was predominantly white, in Kirkwood and others, that the disparity when it came to who went back to school in person and who didn't was substantial. And that has been chronicled throughout the US, where the white communities predominantly would go back into in-person school because of this big concern, and because of the factors Dr. Purnell just mentioned about, it impacted our Black community much greater, and the scare to go back into a congregate setting like a school was like, you got to be crazy, right? And I think that was a major issue up front that we had to be addressing. And so the work that was done, and I think that we're seeing, is that one of the safest places for our people to be is in our schools, because of people like you, your staff, your teachers, your environmental service workers, everybody in your school has bought into the fact that, well, we know what we have to do. We have to wear our mask. We have to do, washing our hands. We have to do cleaning. We know we have to work with the people that have sick kids and how we do best to support them in this. And when we do all of that in all of our communities, we've seen transmission to be lower. I mean, transmission of COVID-19 between one another to be lower. Now, on top of that, we then add in the vaccination. And as Dr. Purnell and what we're learning especially is like, you got to go to people. And when you hear this notion, and I've gotten to where I hate the word hesitancy. I absolutely hate the word vaccine hesitancy, because I think that labels somebody that, oh, they must not want it. And that is actually quite false most of the time. I'd say 90% of the time, especially in our Black community, we don't find that. But the reality of it is, what we have seen is that the vaccinated by far and away are the most protected. It is clear. It still is clear in the surface of Omicron, and even some who says, well, I've had it, I'm going to be fine. Well, it's still clear that you're vaccinated, you're not ended up in the hospital. Rarely, some still do, but that's why you have to vaccinate everybody, so you protect those who might, even when they are vaccinated. And I think in the end, that's how we're going to continue to improve our community, all of our communities, and especially our Black communities.
As the science and medical understanding of COVID evolves, the guidance evolves along with it. Emerging data shows how well vaccination and booster shots offer increased protection by decreasing the chances of those infected becoming severely ill, hospitalized, or even death. And when I see how the vaccination rates have been low in North County, it certainly concerns me. And I just want to touch on this a little bit. And so let's talk a little bit about the safety of the vaccine and the importance of vaccinations and boosters.
Yeah, so the vaccines have been an amazing accomplishment of our medical science. And I think we'll just start talking about, some people say, well, it's so fast. Well, let's be clear that coronavirus researchers have been looking at this virus since the 80s, 1980s, right? So this is 40 years in the making. And this is why we have medical science. This is why we have the National Institutes of Health, to be prepared for what we saw. So when the pandemic hit, even in January of 2020, you had people already thinking, okay, I know that spike protein, you're like, Jason, why are you going spike? But look, the spike protein, the part of the virus that is so important, we already knew that was the key. Yeah. And so the scientists already knew that that's how they were going to make the vaccine. They had this technology now that had been developed that could be a great way to deliver the vaccine. That's that mRNA. And all we needed to do was to see if it was safe. Really, that's what we had to do. We had to get this into people to make it safe. So we could jump quickly to do that. And that was because we already done all the science. Like if we didn't have all that, we would not have a vaccine right now. Yeah. We would literally be sitting here still toiling with what we had been doing. And that is what we are going after. And that was the original goal of the vaccines all along, was to make sure that we turned again a fatal virus, a virus that can kill us, into a common cold. Mm-hmm. And unfortunately, our good buddy, Dr. Davis, had to experience this, but he was vaccinated. And I am also so thankful, and the healthcare system is thankful for all of the people that get vaccinated and boosted. I thank everybody that has gotten COVID and they said, yeah, I've been vaccinated and boosted. Well, thank you, because you really have helped our healthcare system. You've allowed us to be able to take care of the person that comes in with a heart attack or the person that gets in a car accident that needs something else, because you have allowed us to have extra beds or extra resources so that we can care for them. And that's the reality. Vaccination is helping us all, especially our healthcare system right now.
We know so often in our communities that there is a lot of misinformation, right? Dr. Purnell, if you could, I want you to touch on some of those concerns and myths and mistrust in our community that may cause individuals to be hesitant about getting the vaccine and thus the booster.
Well, there's myths, and then, I often talk about the difference between mistrust and distrust. Mistrust sounds like you're making a mistake. Distrust is based on experience. So the African-American community has good reason to be skeptical, to be whatever word you want to put on top of vaccines, because we have been systematically mistreated by the healthcare system in the United States. With that said, data alone is never going to be sufficient to change people's minds. Mm-hmm. People need to hear stories. They need to hear from people they trust. They need to be able to look and see with their own eyes what the experience of other people have been. And when you look at the national data on vaccine attitudes among African Americans, you saw a large number, perhaps the largest number, was in the wait and see category. Mm-hmm. Not the hell no, never will I category, but in the I want to wait and see how this plays out. So, we see common concerns around the ingredients in the vaccine, the side effects of the vaccine. Some people have concerns about the cost. Some people have very legitimate concerns about if I feel like a truck has hit me, as Dr. Newland said, can I take off of work for that 25 to 36 hours? So, it's not all just misperception or myth. People have very real concerns.
We know there is light at the end of the tunnel. We know that this latest surge of Omicron has created challenges in our school district and across this entire globe. What's our path forward?
Well, I think we have to learn from this experience. Part of what I've learned is that when we talk about equity, when we talk about health equity, when we talk about equitable access to healthcare and other factors that support health, none of that works on autopilot. We have to be intentional about it. So that means in every decision that we make, we have to ask ourselves, okay, so how will the most vulnerable, the most challenged, the person with the least resources access what they need to be healthy. And that has to be the way that we design the entire system. We have something we call universal design that came up after the Americans with Disabilities Act was passed, and universal design are those things are, the cutouts and the curb. Turns out that's good for everybody, not just for somebody who's in a wheelchair.
Mm-hmm.
But we have to design more of our systems for the people who have the most challenges, and we'll find out it makes it easier for everybody to have access to what we need. That's, to me, that's probably the thing that I would take from this pandemic and the way that we need to move forward as we're facing other challenges.
Awesome, thank you so much. Dr. Newland, what are your thoughts about where do we go from here?
Well, I mean, I think from the virus, and I'll just speak obviously to the virus piece, what's going to happen with COVID-19 next. I mean, Omicron has just the sheer number of people infected, and the fact it's less severe. But as you mentioned rightly, it's still overloaded our hospitals. It's put our healthcare systems on the brink. The unbelievable demand and necessary for testing, though we haven't been prepared for testing. And I think, as Dr. Purnell just mentioned, right, like, we got to develop systems so that anybody can be able to get tested. And right now we're all saying we can't even test. We can't test because we don't have enough. And that's been very difficult.
This has been great. I really appreciate both of you taking the time out this morning to give us your insight, your expertise, and the work that you're doing in your respective parts of your jobs. We understand that some people may be concerned about getting vaccinated. Wearing masks and staying physically apart from others helps reduce our chances of being exposed to the virus or spreading it to others. But these measures aren't enough. Getting the vaccine and booster adds one more layer of protection for you, your family, and your loved ones. Research continues to show that vaccines and boosters are the most vital tool we have to protect our community. It lessens the severity of the virus if you do get it. And we want folks to know that we scheduled another vaccine/booster clinic coming up on Saturday, January 22nd from 9 a.m. to 3 p.m. at Steam High School at MSB. So please come out and get vaccinated or get boosted, whichever one you're eligible for. Please come and get that. Again, that's Saturday, January 22nd from 9 a.m. to 3 p.m. at Steam High School at MSB. All the vaccines and booster brands will be available. If you're unable to make that, then there'll be other opportunities that we'll provide for our community. And we'll, as Dr. Purnell said, we're going to bring it to the community so that folks take away the barriers. We want people to get vaccinated and boosted and be safe. We all play our part in this effort if we come together, as Jason said, and as I was taught, that three things: faith, hope, and love. The greatest of these is love. Working together, we can stop this virus. Dr. Jason Purnell, Dr. Jason Newland, thank you so much. These esteemed gentlemen, we are grateful that you were with us this morning. Be well. Thank you.
Thanks, guys.